So welcome back again to our Missi Care Online Health Education. Today we're honored we have a very renowned dietitian, experienced dietitian from YSP, and she is a brand executive for Font Active, with the milk powder from Spain. And she will share with us what the problem with nutrition among elderly and how her product Font Active can help us. Now, nutrition in elderly is very specialized topic because elderly, their digestive system is a bit different from the normal adult. Their appetite may be poor at times because of the age, because of the certain ailments, and they may have the teething problem. The teeth may have problem to chew, the muscle weakness, the swallowing may be an issue as well, and then appetite can be poor at times because psychosocial issue as well. And certain food may not be absorbed well as well, and then they commonly have other ailments, for example uncontrolled diabetes, bed sore, wound infection, urinary tract infection, pneumonia, or even stroke patient or tumor. And these certain illnesses may need higher protein intake, and the body unable to cope, so we may need certain supplement, like for example Font Active, to improve the nutrition elderly. So nutrition elderly not only to improve their health but also improve their immune system, so that they will stay away from infection, pneumonia, bed sore, and tumor as well. Right. So we'll hear from Miss EILEEN how she can give us more insight on the nutrition elderly and how her product can help. So we will divide the talk into 2 episodes. Today we will start with first episode about nutrition elderly. So Miss EILEEN, please.
Hi everyone, I'm Miss EILEEN. So without further ado, I will talk about this nutrition in elderly. So at what age you are being categorized in elderly? So first of all, I will talk about the categorized of the age. According to this World Health Organization, they have revised the age standards in the year of 2015. Based on the new age classification, elderly is in the age between 60 years old to 75 years old. Then 75 years old until 89 years old is considered senile age. And then those who live 90 years old and above, they are considered long livers.
I'm going to elderly soon.
Okay, so what is healthy aging? So healthy aging is not a life without diseases, because disease can happen at any age. According to this World Health Organization, WHO, they define that healthy aging is an ongoing process of developing and maintaining the functional ability that enables well-being in older age. Okay, so there are 4 elements of this healthy aging. First is functional abilities. The abilities to perform activities of daily living, such as bathing, dressing, shopping, doing your house chores, and etc. Then second, we have this intrinsic capacity. Is a combination between this physical and mental, including psychosocial as well. Then number 3, we have this environment. Environment is our surrounding, which inclusive all the factors in this extrinsic world. Then number 4, we have this well-being. Well-being is categorized as your happiness, your security, and then your fulfillment. So all these are 4 elements of this healthy aging. Okay. So there are 5 ways to eat well for elderly, because why we need to eat well as we get older? Because it will help us to maintain our health, and then so that we can be more stronger and healthier as lives go on. Okay, so number 1, you need to know what a healthy plate looks like. Okay, a healthy plate actually is a very simple and practical aid for healthy nutrition. In a plate, so you can divide your plate into quarter, quarter and half. So this quarter, quarter and half is a very easy way to remember the food portion of each food groups in the well-balanced diet. Okay, first of all, you can fill in quarter of your plate with these whole grains, such as your rice, your noodles, your porridge, and your bread. Then another quarter, fill in with these protein sources, such as your fish, meat, then eggs, or tofu if you are vegetarian. Then another half should be from these vegetables and as well as fruits. Okay, then when we talk about this food portion, we can also use our hand as a very easy guide to help us estimate the food portion. Okay, you can use a clenched fist, okay, in which it corresponds to your carbohydrate sources such as your rice, your noodles, or your mee hoon, and etc. Then our palms actually estimate the protein we need, and then 2 handsful of these vegetable and fruits will do. So all this will make a healthy plate. Okay, then next we have this Malaysian food pyramid, in which we need to follow the recommended serving size as what suggested by this food pyramid. Remember, our keywords call this BMV, balance, moderate, and variety, because there is no single food in the world could provide all the nutrients needed by our body. So we need to eat a wide variety of foods in order to meet our daily nutritional requirements. So B stands for balance, M stands for moderate, not too much or not too little, then V stands for variety. So let's say you go for these fruits, make sure you eat a variety of these fruits, not only a single type only. Okay, so when we talk about this Malaysian food pyramid actually is a simple guide for us to vary our food intake according to the suggested serving size. There are 4 levels as shown in the food pyramid. These 4 levels actually represent 5 food groups in our daily meal. The first level consisted of these vegetables and fruits. So vegetables, we are being encouraged to eat at least 3 servings per day. Then for fruits, we are encouraged to eat at least 2 servings per day. So moving up on the second level, so we have this rice, cereals, whole grains, or our cereal based product or tubers. So for this category, we need to at least take 3 to 5 servings per day. Then at the third level is our protein sources, in which consisted of fish, poultry, eggs, meat, legumes. So for fish, the recommended serving size is 1 serving per day. For poultry, eggs or meat, you can take 1 to 2 servings per day. For legumes, opt for 1 serving per day. For the milk and milk product, it is also located at level 3. So we are being encouraged to drink at least 2 servings of milk per day to get our calcium sources. Then located at the top of this pyramid is the food that we need to take in a minimal amount. So we need to limit our intake of fats, oils, sugar, and salt. Tips number 3 will be, we need to look for important nutrients, especially protein, calcium and vitamin D, fiber, B vitamins B complex, and as well as iron. For elderly, normally they need protein in larger amount compared to younger adult, because aging body actually process protein less efficiently, as it need more to help to preserve the muscle mass and muscle strength. So protein, it will help to build our muscle protein, and the good sources of this protein will be from fish, poultry, eggs, meat, legumes, and milk. For calcium and vitamin D, there are 2 important nutrients essential to maintain our healthy bones and as well as healthy teeth. Vitamin D, also known as sunshine vitamin, because it could be produced in our skin in the exposure of sunlight. So for elderly, it is quite common in which they tend to have a lower vitamin D because they stay indoors most of the time. So together with this calcium, vitamin D actually can help to encourage the absorption of calcium in our body. Sufficient intake of this calcium and vitamin D actually can help to prevent or minimize the risk of bone loss and as well as risk of osteoporosis. So the good sources of this vitamin D and calcium will be from milk and milk products. Number 3, we have this fiber. Fiber is also one of the important nutrient in which it could help to promote bowel function, and as well as it could help to lower cholesterol and stabilize our blood sugar level. So those elderly, if let's say they frequently suffer from constipation, or they have this high cholesterol issue, or even though if they have this immune function disorder due to digestive problem, we are encouraging them to eat more fiber, because a diet high in fiber, it could help to minimize all these health issue, especially those related to the bowel part. Most of the time, vegetables, fruits and whole grains, they are good sources of fiber. Next, we have this B vitamins B complex, in which they play a very important role for various functions in our body, including energy metabolism, to help our body to convert food into energy, then synthesis of this DNA and repair, and as well as our immune function as well. For those who are frequently feeling tired, fatigued, so they can take more food that is high in this B vitamin complex. So the food sources are those whole grains, or if let's say you are a vegetarian, nutritional yeast will be one of the good sources of this vitamin B complex. When we talk about this iron is one of the important nutrient in which it could help to improve our blood health. We know that this iron deficiency is second most reason for the anemia in elderly. So if let's say elderly, they have this iron deficiency kind of anemia, so we encourage them to include more meat, and then or dark green leafy vegetables in their diet, because all these food are rich in iron. Okay, so number 4, we talk about this consuming foods lower in fat, salt and added sugar. The cooking method we use normally will affect the nutritional value of the food we serve. So we encourage you to go for healthy cooking methods such as baking, boiling, braising, steaming or grilling, because all these healthy cooking methods, it could allow for minimal loss in the nutrient, and as well as it could prevent us to use a large amount of these fats in our meal, to prevent additional kind of calories, excessive calories intake. Then another point will be on replacing salts with these herbs and spices, because normally herbs and spices, they could help to minimize the sodium intake without sacrificing the flavors of the food. So you can try to start with a minimal amount to include them, such as this cilantro, onion, garlic, and then black peppers, to replace the salt used in your cooking, so that it could help to minimize the risk of getting high blood pressure for elderly. So try with a small amount first, then to see if let's say elderly they like it or not. Okay, next we will talk about the ways to reduce added sugar. For beverage, we will encourage you to primarily drink plain water, or choose low-fat milk or 100% juice. For fruit, try to eat fresh, whole fruits instead of canned and preserved food. For dairy milk, choose those unflavored one, or the plain one, or unsweetened version will be better for elderly. Tips number 5 will be stay hydrated. For older adult, normally they tend to have this dehydration risk due to the several reasons, and including this diminished sense of thirst. We encourage them to aim for at least 6 to 8 glasses of fluid per day. If let's say they have trouble to drink fluid, you can also include these water-rich foods in every of their meals, such as cucumber, tomato, watermelon, bell pepper, grapes, cantaloupe, orange, blueberries, and apples. So all these foods are high with this water content. Next, we will talk about these common eating problems in elderly. For elderly, The most common problem that we observe will be chewing difficulties, reduced taste, dry mouth, poor digestion, or poor appetite. And all these problems actually will cause them to unable to get all the nutrients needed by them, and then subsequently it will affect their nutritional status. So there are several ways to overcome this problem with the dietary modification. Okay, first of all, we look at these chewing difficulties. The common causes of these chewing difficulties is due to loosened teeth, decreased saliva secretion. So the strategies to overcome this problem will be choose the food with suitable texture, or you can cut the food into smaller pieces by chopping or grinding it, or modify the food texture by pureeing it with this blender before eating, and cook this food until tender, or you can even add sauces into the food to make it more soft. Then second eating problem will be this reduced taste. This reduced taste could be due to the deterioration of this taste bud, or sometimes it could be due to the medication use. So we encourage you to use herbs or spices such as this ginger, spring onion, garlic, or dried tangerine, or some western herbs like parsley, coriander, or this pepper to season your food. And then we will encourage older adults to chew their food properly, and then ensure their dental hygiene is in a proper way. Number 3 will be the dry mouth. Dry mouth could be due to the reduced saliva production. So if let's say elderly have this kind of problem, so to ensure them to get adequate of this fluid intake. For this food selection, they can choose moist food such as congee, mashed potato, or steamed egg pudding. Then they can provide food with these sauces or gravies or clear soup, or if let's say they take in food which is very dry such as like bread or crackers, so you can soak it into the milk or the soup, then eat together. Another point will be they can drink some water to moisten their mouth before meals, or chew on this fresh lemon slide to stimulate their saliva secretion. Okay, number 4 will be this poor digestion due to the reduced saliva or digestive uses. For this kind of problem, we will encourage elderly to have a small and frequent meals, and encourage them to chew slowly so that food is being chewed thoroughly, so that it can causes the food to be enter smoothly into our stomach. Then our stomach no need to produce too much of this digestive juice to digest the food. What we will encourage will be try to avoid intake of fried or high fat food, because all these high fat food actually will delay the stomach emptying time and reduce the intake of caffeine or alcohol containing food drinks, and avoid lying down straight after each meal. The last eating problem that we observe will be this poor appetite. So for poor appetite, the possible causes could be due to illness or gastrointestinal discomfort, side effect of some drugs, or poor psychological or emotional well-being. So for food with bland colors can be made into more interesting or exciting with the addition of these bright or interesting garnishes, or can prepare food that are nutrient dense by adding more minced meat, fish, eggs, potatoes, or dry beans into congee, or the noodles or the soup they drink.
So actually, to highlight on that, for our nursing home elderly, we are very particular about how we present the food to our residents. So not only it has to be cooked fresh, it also have to be warm. So we warm it up and then heat it up just before presentation. And as EILEEN rightly said, you have to use certain colors of the food, natural color like kunyit to make it more interesting, and use a chili to make it look red for them, more palatable. And recently we also have changed our plates and cups to look more presentable like a restaurant. So all this actually, for a person to eat, it starts from the eye and the smell and then taste. So from the eye visual, have to start stimulating the appetite, and so as the smell and also the taste bud. That is a very common problem with the elderly. You can see if the elderly nutrition, their poor appetite, you can see the health deteriorate very fast. So we have to stop it from the very early stage, right? So back to the previous slide, talking about the 8 to 10 glasses of water, that's very ideal and a healthy way of doing things. However, in certain scenario, especially when it comes to the kidney, I'm a kidney specialist. So in kidney failure patient, heart failure patient, liver failure patient, we may have to reduce the fluid intake like up to only 1 liter a day, which is about 4 glasses or even less than that, to restrict the fluid intake. Otherwise, they get fluid overload, go into the lungs, worsening of the bed sore because of the edema as such. So it's very complex and complicated when it comes to nutrition in elderly, and no one standard regime fits all. So have to most of the time we have to cater individual meal for each of them in terms of the fluid intake, in terms of certain food, and as you rightly mentioned, certain elderly you may have to blend it in order for them to eat it, right? And the other problem that we commonly see, almost about 20% of our residents are tube feeding. So whatever we talk about here may not be suitable anymore.
Yeah.
And whereas second part of the talk, Ms. EILEEN will talk about how her milk product will help in terms of supplementing the nutrition and also on the tube feeding part, right? So stay tuned, and we'll come back for the second episode, right? Thank you, Ms. EILEEN.
Thank you, everyone.